All right, we're back, and we're going to be talking about the third trimester, which is sometimes the hardest one, depending on how sick they were in the first trimester. But in the first trimester, they're really, really sick. And in the second trimester, you feel actually pretty good. But then the third trimester, you get really, really big, which brings a lot of other problems with it. Or I shouldn't say problems, but nuisances. At any rate, people are talking about birth plans now. We're teaching about breathing and relaxation techniques, and hopefully they are taking a class that describes the labor process, the 3 stages of labor, what is expected of them, how they want to have their pain reduced, or if they just want to do natural. All of that goes on. Infant care, what's the most important aspects of infant care, postpartum care, and a very, very important part of this whole thing would be the fetal movement or the kick count. And we'll be talking about that in the next slide. But we definitely need to educate them on uterine contractions. We know that preterm labor is any contractions after 20 weeks and before 37 weeks. That's considered preterm. And it's considered a contraction if it starts increasing in frequency, meaning they're coming closer together, and intensity. If they subside or go away with rest or walking or even drinking some water, we call those Braxton Hicks or false contractions. So all of that needs to be discussed. And of course, diagnostics testing, we may be able to talk about non-stress tests where we're testing the baby's neurological function, what an amniocentesis is, ultrasound, so forth and so on. All of this needs to go on during the third trimester. So in discussing the fetal kick count, that's basically just that they can actually feel the baby kick. And we have what we call the quickening or the fetal, where you can actually tell there's a baby and they're around 20 weeks, but they're not real severe kicks yet. The baby hasn't put on enough weight, but usually after 28 weeks, we can count those kicks. And again, we want 10 fetal movements in a 3-hour period, or at least 3 in a 60-minute segment. So we're going to recommend that the moms count the fetal activity 2 to 3 times a day, not every hour, every other hour, every 4 hours, but just 2 to 3 times a day. But we want them to count for an entire hour. Like how many do they feel in an hour? And basically, they want 10 fetal movements in a 3-hour period. Non-reassuring count is less than 3 fetal movements in a 1 hour. Is less than 3 in 1 hour. But again, if you're going to count a 3-hour period and you get 10 in any one of those hours, that's considered reassuring. If it's non-reassuring, so we're not getting these numbers, they need to be seen. And now we're going to talk about common discomforts of pregnancy, which this is just part of a list, but it basically kind of covers most of it. Nausea and vomiting in the very first trimester, it comes with, I think, 60 to 80% of women feel at least one or the other of nausea or vomiting. We tell them, one of the things we can tell them is before they get out of bed, if they can, eat dry crackers or dry toast. That helps because a lot of this the whole GI tract is hit with our progesterone. Our lovely hormone that we have to maintain pregnancy slows emptying. It slows everything in the gut. So one of the theories of why we're so nauseous is that we have all this free-floating acid that's sitting there. It's not getting pushed through. Breast tenderness comes from increased estrogen hormone. Urinary frequency, UTIs, all to do with the urinary tract, is just anatomically where the uterus is in relation to the bladder. And we know with UTIs they can get with the urine stasis. So again, encourage them to empty that bladder, to wipe from front to back. Avoid bubble baths. There's stuff sometimes in those soaps, the perfumed soaps especially, that can help them get an infection. Avoid tight-fitting pants. Push the fluids, 8 to 10 ounces of water a day. Yogurt helps to prevent urinary tract and vaginal infections by acidifying the pH of the urine. Cranberry juice, again, lowers that pH of urine and aids in UTI prevention. Heartburn, constipation, hemorrhoids, all of that goes along with elevated progesterone levels. due to the stomach displacement by the enlarging uterus and slowing of the GI tract motility. Again, the large gravid uterus pushing up can help for that, or help the epigastric acidity. Patient, we can instruct them to eat small, frequent meals, not allow the stomach to get too empty or too full. For constipation, drink, again, push the fluids, high fiber diet, exercise regularly. Hemorrhoids, there's a lot of pressure in that area. Some of them go away, some of them remain permanent. Backaches, again, it's a lot of pressure on the pelvis. Shortness of breath, let's talk about that for a minute. That occurs in 60% of patients. It's related to the diaphragm being pushed up by that. Again, this is the third trimester, the very gravid uterus, and it can actually elevate that diaphragm up to 4 centimeters. So knowing this, we can tell them that, about the 38, 39 week, the baby will drop, and that's a phenomenon called lightning. And the women can all of a sudden, they'll tell you they can breathe much better, but what's happening is, yes, they're breathing better. However, they are avoiding more, because as the baby drops, it's now pushing more pressure on the bladder. But with the shortness of breath, we can just tell them, sleep with extra pillows. That helps. Leg cramps can be due to poor peripheral circulation due to the enlarged uterus, compression of lower extremity nerves and blood vessels. Again, tell them to sit without their legs crossed. Not a lot of standing in one position at one time is not good, like postal workers, unless they walk, that's not good. Nursing, we're on our feet all the time, but we're usually not just standing, which helps. Varicose veins and lower extremity edema. Again, drink adequate fluids and don't cross legs. Gingivitis happens because we have nosebleeds from extra estrogen. So with that, just very good oral hygiene. Braxton Hicks contractions, again, can occur in the third trimester. It's just like the body's getting ready to empty out. Inform that change of position and walking should cause contractions to subside. Again, if they increase in intensity and frequency, they're probably true contractions, and they need to come in and be evaluated, as opposed to not be. So tons of teaching. And then supine hypotension is when the mom lies on her back and the weight of that large uterus compresses the ascending vena cava. They can become extremely dizzy, and we don't want that to happen because we don't want them to fall. And now here are some of the danger signs of pregnancy. Any bleeding prior to 37 weeks is not good. It can indicate a placenta problem with either previa or abruption. Abdominal pain can be premature labor, again, abruption, or an ectopic pregnancy. But ectopic pregnancy would be early on. It wouldn't be at the end. The placental problems would be third trimester. The placental problems with previa and abruption would be the last trimester, and you'll be learning about those later. Persistent vomiting, regular vomiting at the first trimester, very, very normal that we do see 60-80% of the people, but persistent means it's up to 20 weeks. And then we're talking about hyperemesis gravidarum, which can be a very big problem because we're losing needed fluids and electrolytes. Severe headaches cannot be ignored with a pregnant woman. It could mean that there are PIH, or pregnancy-induced hypertension, which is, we'll break that down later for you, but just antepartumly, we're going to teach about that. Elevated temperature, again, the most common infection will be a UTI unless they get some other type of throat involvement. Dysuria is a sign of UTIs. Blurred vision can be a sign of PIH. Edema of the face and hands, again, that's central edema, PIH. Normal edema is of the ankles because we've got this, again, big gravid or pregnant uterus sitting on those large vessels bringing blood back to the heart, and it can't. So that's why we have most women, not everybody, but almost everybody has edema of the ankles. When we're talking about the face and the hands, we're talking about more centralized edema, and that can be a symptom of PAH. Epigastric pain, same thing, along the PAH algorithm, and you will see that when I teach you that. We have liver involvement, and in the right upper quadrant is the liver. So we don't ever want to have epigastric pain. Abdominal pain should be related to contractions, but not the liver. And you all should know the signs of hyper or hypoglycemia can be a diabetic problem. And that is the end of video 3. We'll come back and talk about the EDB and the EDC, which we've kind of already alluded to. So I'll see you next time.